According to a top World Health Organization scientist, the Delta variant is the world's most dominant strain of the coronavirus. According to scientists, the variant is outcompeting and replacing other strains, prompting the World Health Organization to downgrade its advisories on the 3 other virus variants.
And new statistics from Johns Hopkins University show the U.S. is now averaging 2,031 COVID deaths a day, marking the highest number of deaths we've seen in 6 months. Senior scholar at the Johns Hopkins Center for Health Security, Dr. Amesh Adalja, joins us to discuss the numbers further. Doctor, welcome.
Thanks for having me.
And so can you tell us, what you're seeing around the country when it comes to these other variants that keep popping up in news articles that try to bump Delta off the front page, yet Delta just keeps pushing back against them?
You have to remember that this virus has thrown off many variants since it first landed in humans. And many of those variants you don't know the names of because they weren't that significant. But we're doing a lot of surveillance now, trying to understand all of the different evolutionary groups of this virus. And what we're finding is, yes, there are other variants that occur even in the United States. But when it comes to Delta, because it is so much more fit, because it is so much more efficiently transmitted, these other variants kind of come and go, but they never get a toehold because it's just kind of simple Darwinian natural selection that Delta is the dominant variant and all of these other variants kind of pale in comparison when it comes to their ability to infect. And that's what matters to this virus, just finding more people to infect. And Delta is crowding all of the others out.
And how does that crowding out work? Because can the body not generally get infected a second time? Let's say Delta sweeps through a town, infects a ton of people, and moves on. Why can't another variant then come in behind it?
So it's a couple of things. So one is, yes, once you've gotten natural immunity, you've been infected, it's going to be very hard in the short term for any of the other variants to be able to get around that robust immunity that you get in the months after your natural infection. It's also the case is if there's a swarm of viruses, maybe you have in a given country, maybe you've got some deltas, some beta, some gamma. And initially in the United States, we had delta competing with alpha. You really are only going to get infected for the most part with one of those viruses. And if Delta is something that transmits so much more efficiently, it's going to be the one that gets you versus all of the other swarm of variants. And over time, those variants will have less and less people to infect, and they'll become less and less important and basically become extinct. I think in the United States, most of those other variants are on the verge of extinction because of Delta.
And let me ask you, roughly how effective are the vaccines against Delta?
When it comes to what matters, serious disease, hospitalization, and death, the vaccines are holding up really, really well, all 3 of them. We have seen breakthrough infections become more common with Delta. That may have to do with the fact that Delta is more transmissible. Maybe it has some more abilities to kind of evade the protection from a vaccine for mild infections. And also, we know there's a lot more virus out there right now than there was just several months ago. And we also know people are back to their activities, so that increases their risk. So it's hard to tease all of those apart, but the vaccines are protecting us against what matters. And that's something you have to keep in mind, because remember, the virus isn't going to be eliminated or eradicated. Our goal is to tame it, to make it more like other respiratory viruses we deal with year in and year out. And the best way to do that is through vaccination, especially of high-risk individuals.
If Delta is going to be the variant that's dominant worldwide, is there talk about tweaking the vaccines to that variant?
There has been talk of that from the very beginning. Right now, what we're seeing with boosters and the whole discussion over boosters is using the same formulation because, again, it does protect really well against serious disease, hospitalization, and death, even with Delta, even with other variants that we've seen. So there hasn't been a big push or need to do this. But if Delta becomes the dominant version and everything else evolves from Delta, there may be an argument made that future iterations of the vaccine might be better based off of Delta than off the original Wuhan strain.
And so President Biden announced Wednesday that the U.S. will buy 500 million more doses of the Pfizer vaccine to donate to countries in need, adding to the 500 million doses purchased back in July. In my mind, a great step because it's very much a global pandemic. It's in our favor to be helping our friends and our allies to inoculate themselves against it. But let me ask you, Doctor, what is the magic threshold, and bear with me, I don't come from a medical background, of vaccinated people, our percentage of vaccination we have to reach in the U.S. in order to largely be able to get to a place where COVID is something like the seasonal flu that we deal with, on a yearly basis, but is largely under control?
It's unclear because we know, looking at studies of blood donors, that we had over 80% immunity in this country with a combination of vaccine and natural immunity, and Delta was still able to take hold. It's more about making sure that the people that are at high risk for hospitalization, those elderly, those with comorbid conditions like diabetes and obesity, that they're protected, because that's where we see the severity. That's where we see hospitals going into crisis. So if you've got immunity in those high risk populations, and clearly we don't, especially in some of the southern states, especially in some of the Midwestern states where we're seeing major pressure on hospitals, it's not going to matter if everybody else is immunized if you still have a lot of people that are high risk that are not immunized. But we're looking at probably 80-90% of the population having some sort of immunity for this to be something that can be considered as the flu or equivalent for the whole country. And I think that really is a calculation that's changed because of the Delta variant being much more contagious than other versions of the virus.
And you often see people say that that even if you're vaccinated, you're just as likely to spread. You're just as likely to infect somebody else. What is the science telling us on that so far?
The science is telling us the exact opposite. If you're somebody that gets one of those breakthrough infections, which are not common, yes, your viral load may go up and you might be contagious, but what we know is that the immune system jumps into action very quickly and that viral load slams down very low. And even if you look at the viruses that come out of people's noses that have had a breakthrough infection, those viruses are defective. They're not really able to infect cells in a laboratory setting the way virus from someone who's not vaccinated was. So when you look at the proportion of transmission going on from vaccinated people, it's very small, very rare circumstances. What's driving transmission is virus moving from one unvaccinated person to another unvaccinated person. We are, as the president has said, in a pandemic of the unvaccinated. It's not surprising that states that got hit hard were those with the lowest levels of vaccination.
That's a very interesting point, because I think that's something I hear very commonly from folks who are vaccine skeptics, is to say even the vaccinated can spread it. So I really appreciate you sharing that. Let me ask you this. Obviously, your background is the science and the medicine, but I think all of us are facing cases of trying to explain to people who are hesitant to get vaccinated why they can trust the science, why they should. What do you think is the most effective thing from a medical perspective that you would convey to those who are skeptics of the vaccine to consider getting vaccinated?
The most convincing thing to me is just to have them open their eyes. Just go to their local community hospital and ask, what's going on in your hospitals with COVID? You will see that this is really unvaccinated people that are inundating community hospitals right now, not the vaccinated. You can see how many lives have been saved. Just look at what happened with, for example, nursing home deaths when the vaccine was made available to them. So to me, I think this is almost kind of sensory evidence that the vaccines have worked. We've put hundreds of millions of doses of vaccines into people, and it really has changed the trajectory of the pandemic. And the safety signals are extremely, extremely good. We have not seen anything untoward when we look at all of the people that have been vaccinated. But it's very hard just looking at those statistics. Sometimes the best thing to do is for them to sit down with their primary care doctor and just discuss the vaccine. We know that they trust their primary care doctors, and I think primary care doctors should have been enlisted very early on, because that's how we sort of move these vaccine hesitant people, because they want a trusted source of information that they can actually converse with. And I've had that same experience. I do much better one-on-one with people that are vaccine hesitant than I do when I'm talking on television telling people to get a vaccine.
And given that treatment has improved so significantly when it comes to COVID, why is it that we still have 2,000 people dying a day?
We still have 2,000 people dying a day because there are many high-risk people who didn't think they were high risk or decided not to get the vaccine. And this virus can still kill. And when you talk about people that have diabetes, obesity, or that are elderly or have lung disease, this virus is really, really dangerous. It is much more dangerous than any of the other respiratory viruses we deal with year in and year out. And although we have great treatments like dexamethasone and certain antibodies we give to people to block their immune system, or monoclonal antibodies to give people when they've been infected, it's still not enough. Once you're in the hospital, your mortality rate goes up, and once you're in the ICU, it goes up significantly, and even more so on a ventilator. So it's still much better to prevent yourself from getting this infection than to think about what's going to be the latest treatment that you might receive in the hospital. Treatment is always inferior to prevention, especially when we have a safe and effective vaccine.
And you had mentioned that you said something like that there really aren't any kind of extreme side effects or downsides associated with the vaccine, but it's not zero. So so is there a point at which you have a harder time talking to people? Say, I think I saw something about adolescent boys and heart inflammation might be some type of risk. What do you say to people who say, like, look, I don't have any of these comorbidities, and I've seen these reports about these side effects, and so I personally think that the risk calculation is a bad one for me.
It is true that no vaccine has a zero risk, and every vaccination is a risk-benefit calculation, and you have to weigh the risk of being infected. And I do think in the midst of a pandemic where we still have over 100,000 cases, that the vaccine is something that is going to be favored in almost every risk group. For those people, maybe an adolescent that's worried about myocarditis, we saw those myocarditis cases after the second dose. Why not get the first dose and maybe space the second dose? I think there's ways to work with people even when there are those side effects because they can be mitigated. And when it comes to myocarditis, for example, it tends to be mild, it tends to be transient, and it may be something that we can forestall just by spacing the first and second doses in those high-risk groups. So there's ways to work with people to try and overcome those side effects if people are actually willing to listen and doctors have the time to actually do this.
Well, Dr. Adalja, thank you so much for joining us. Really appreciate it.
Thank you.
Coming up, The Intercept's Ken Klippenstein discusses new reporting on the Afghan resistance leaders that fled following the Taliban takeover. That's up next.